Hi friends, today we will be discussing two short topic of the antimicrobials, that is sulfonamide and cotrimoxazole. First of all, we will see the sulfonamide. This is the sulfonamide. The classification of the sulfonamide is very important. Sulfonamide are classified into the three types. First of all, systemic acting, the second one locally acting, and the third one both systemical as well as local acting. The systemically acting can be further divided into the three categories. First one is the short acting, second one is the intermediate acting, and third one is the long acting. Example of the short acting is sulfadiazine. Example of the intermediate acting is sulfamethoxazole, and the example of the long acting is sulfadoxine. Then example of the local acting sulfonamide is sulfacetamide, silver sulfadiazine, and mefenidate. And the both locally as well as systemically acting sulfonamide is sulfasalazine. So this is the classification of the sulfonamide, which is very important. Then we will move to the mechanism of action of the sulfonamide. If you know the folate pathway, it is very easy for you to remember the mechanism of action of the sulfonamide. In the folate pathway, we will see that para-amino benzoic acid will be converted into the dihydrofolic acid with the help of the enzyme folate synthase, and that dihydrofolic acid will further converted into the tetrahydrofolic acid by the help of the enzyme folate reductase. And that tetrahydrofolic acid is essential for the growth and multiplication of the many organisms. When we give that sulfonamide, the sulfonamide will block the folate synthase, and that will block the conversion of the para-amino benzoic acid into the dihydrofolic acid. By this way, dihydrofolic acid will not be formed, and as a result, tetrahydrofolic acid will also not be formed. Due to this, there is the essential element for the growth and multiplication of the microorganism is absent. That's why the growth and multiplication of the microorganism will not be happen, and we will get rid of that microorganism. By this way, sulfonamides work. So this is the mechanism of action of the sulfonamide. Then the therapeutic use of the sulfonamides is that it is a very vast list of uses of the sulfonamide, because every drug of the sulfonamide category is used for a different disease. Let's see. First of all, sulfacetamide, which is a locally acting. This one is used for the ophthalmic infection, using the eye drop. Then the second one, silver sulfadiazine and mefenidate. These are also the locally acting, which are used as a preventing infection from the burn wound. Then the third one is sulfasalazine, which is both systemically as well as locally acting sulfonamide, sulfasalazine. So it is used for the inflammatory bowel disease and rheumatoid arthritis. Then the fourth one, sulfadiazine, which is a systemically acting short acting sulfonamide, is used with the pyrimethamine in the prophylaxis of the rheumatic fever. Then sulfamethoxazole with trimethorphan, it is used for the treatment of the nocardiosis and the P0AC infection. And sulfadoxine, again with the pyrimethamine only, it is used against the chloroquine resistance Plasmodium falciparum malaria. So these are the group of drugs used against various kind of diseases. This is the therapeutic use of the sulfonamides. Then the adverse drug reaction of the sulfonamide is in neonate, that it causes kernicterus and hemolytic anemia due to G6PD deficiency. The hypersensitivity syndrome, hypersensitivity reaction, that is Steven-Johnson syndrome, fever, arrhythmia, multiformia, ulceration, skin rash, itching is the normal. And then crystalluria, hematuria, bone marrow suppression can also be seen. These are the some adverse drug reaction of the sulfonamide. So by this way, these are the whole information, brief information about the sulfonamides. Now the cotrimoxazole. Cotrimoxazole is a fixed dose combination. It is a fixed dose combination of sulfamethoxazole plus trimethoprim. These are in the ratio of 5:1, that is 5 parts of the sulfamethoxazole and 1 part of the trimethoprim. The mechanism of action of the cotrimoxazole is nearly similar to the sulfonamides. That is para-amino benzoic acid, PABA, which will be converted into the dihydrofolic acid by the help of the enzyme folate synthase, and dihydrofolic acid will be converted into the tetrahydrofolic acid by the help of the enzyme dihydrofolate reductase. And tetrahydrofolic acid is essential for the growth of the Now when we give the cotrimoxazole to the patient, that the sulfomethoxazine group of the cotrimoxazole will block the folate synthase, and it will reduce the conversion, or it will stop the conversion of the para-amino benzoic acid to the dihydrofolic acid. And the second part, that is trimethoprim, will act on the dihydrofolate reductase, or inhibit the dihydrofolate reductase, and inhibit the transfer or formation of the tetrahydrofolic acid from the dihydrofolic acid. By this way, there is reduction, or there is stoppage of the formation of the tetrahydrofolic acid, which is essential for the growth of the microorganism, and that's why tetrahydrofolic acid will not be present and growth of the microorganism will not happen. That's why we can control the growth and multiplication of the microorganism. This is bactericidal in combination. Therapeutic use of the cotrimoxazole is that in urinary tract infection, we can use it in the urinary tract infection of the lower urinary tract infection and prostatitis. Then respiratory tract infection like acute and chronic bronchitis. In GI tract infection, in the bacterial diarrhea. Then we can also use the cotrimoxazole in the nocardiosis, chancroids, and typhoid fever. So these are the therapeutic uses of the cotrimoxazole. Then adverse drug reaction of the cotrimoxazole is it will cause the hypersensitivity reaction, Steven-Johnson syndrome, but which is rare. Skin rashes can be there, itching, dermatitis. Then GI disturbance like nausea, vomiting, glossitis, stomatitis can happen as an adverse drug reaction of the cotrimoxazole. Further, megaloblastic anemia due to folate deficiency, which is a rare adverse drug reaction of the cotrimoxazole. After that, leukopenia, thrombocytopenia, neutropenia, bone marrow suppression can be occur due to the cotrimoxazole. And cotrimoxazole is contraindicated in the pregnancy. So these are the adverse drug reaction of the cotrimoxazole. By this way, we have learned the brief about sulfonamides and cotrimoxazole. Thank you.